Good morning, all of you. Today we'll be discussing about Vermilion zone. So, why this particular zone is exactly called as Vermilion? What does the term Vermilion mean? It means the red pigment that is derived from cinnabar. The other names of this Vermilion border are red zone or transitional zone of the lip. Okay, please look at the diagram. See, this is the Vermilion zone. Okay, the outer aspect of your Vermilion zone, you have the skin with the hair follicles. Okay, the inner aspect is the labial mucosa with the minor salivary glands. This is the upper lip, this is the lower lip. Okay, so here in the lower lip, you have the outer skin with the hair follicles. Okay, and this is the Vermilion zone and the inner labial mucosa with the minor salivary glands. So this particular zone is the Vermilion zone or the transitional zone or the red zone. Okay. So this Vermilion zone has got skin on its outer surface and labial mucosa. This one on the inner aspect. Okay. So the junction between the skin and this Vermilion zone is your mucocutaneous junction. Okay. Whereas the junction between the labial mucosa and the Vermilion zone is the wet dry line. So what is the other name? It is the red zone or the transitional zone. So this particular region is the Vermilion border, whereas this is the Vermilion zone. The upper Vermilion zone and the lower Vermilion zone, otherwise called as red zone or transitional zone. Okay, the histopathology. If you see, this is the outer skin. You have the epidermis and the underlying dermis, and these are the hair follicles with the sebaceous units. The inner labial mucosa, which is mostly non-keratinized with your minor salivary glands. And then comes the histopathology of your Vermilion zone. Your Vermilion zone is thin epithelium, has got thin epithelium and it is keratinized. Look at the length of the rete ridges and the papillae of the connective tissue. It is more long and narrow. And you also have the blood vessels very close to the surface. So these are the regions why your Vermilion zone is more reddish because of the thin translucent epithelium and the proximity of the blood vessels to the surface. Another histopathological picture where you have your labial mucosa on the inner aspect with non-keratinized epithelium, and then you have your vermilion border. Okay, look at the thickness of the epithelium. It is less when compared to the inner labial mucosa, and then you have your outer skin. Okay, the epidermis and the underlying dermis. Now, what are the peculiar aspects of the skin on the outer aspect of your lip? So this has got a keratinized layer of epidermis and an underlying dermis. Okay, the epidermal dermal connective tissue interface is got flat interface without any long narrow rete ridges, and your skin has got sweat glands, sebaceous glands and hair follicles. Okay, whereas your inner labial mucosa towards the inner aspect of your Vermilion zone is thin, non-keratinized with minor salivary glands, and you have the orbicularis oris muscle in the submucosa. And what are the peculiarities of the Vermilion zone or the red zone? It lacks both skin appendages that you see on the outer skin and the minor salivary glands that you see on the inner labial mucosa. And any guess why we constantly wet our lips with saliva? Only because this doesn't contain the minor salivary glands. That is why we constantly moisten our lips with the saliva by the tongue. And why it is red in color? Because of the thin translucent keratinization and the proximity of the blood vessels to the surface. That is why your Vermilion zone is red in color. Now moving on to the clinical considerations of the Vermilion zone. Can you all see this vesicles which are crusted? So these are the mucocutaneous lesions that you see commonly in the Vermilion zone. These lesions are more common in lupus erythematosus, and this is actinic cheilitis. Actinic cheilitis is due to chronic sun exposure that you see in fair skinned people. And recently you have your lip fillers. Okay, cosmetic procedures where fillers are injected into the lips to increase the volume of the lip. These are the few clinical considerations. Okay, thank you.